Here's another interesting and common finding. You could recognize the fact this is a heart because you could see the myocardium is cut in cross-section here. You can also see the papillary muscles and the trabeculae carneae along the wall of the ventricle. Also notice that attached firmly to this inside of the ventricular wall is something that looks like a blood clot. It's hemorrhagic. You could see blood. It could very easily be very firmly adherent to the endothelial surface or the endocardial surface of this heart, and that's exactly what it is. It's a thrombus. And whereas thrombi can adhere to the inside of blood vessels, when they adhere to the wall of a heart, any chamber, they are called mural thrombi. Here is myocardium. Here is here is pericardium. Here is pericardial fat. Here is myocardium. And you are led to believe that at the end of this myocardium, we should be finding an endocardium, ultimately ending in a nice endothelial lining. Well, we don't see that. We can certainly see pericardium, perhaps a little inflamed though, isn't it? We could see the pericardial fat in which the large blood vessels usually run. We could see myocardium, and I think we have no trouble recognizing these as myocardial cells. They're muscular cells in which the nuclei is in the center of the striated fibers. But then, where this myocardium ends, we are starting to see something that looks like a blood clot, which is chiefly fibrin, blood, perhaps fibroblasts, inflammatory cells, and this is a very, very classical appearance for a mural thrombus. Here's the cardiac muscle, and this entire thing is the thrombus, and here is where you could see the thrombus attaching to the myocardium, in which there is absolutely no endocardium at all, and you could see kind of a mixture of blood clot here attaching itself through fibrovascular tissue into the myocardium directly. This might be the part of the mural thrombus that you might have a hard time pulling off if you were doing an autopsy. Thank you very much.